or should I say, Dr. Balsama's neighborhood. So, welcome to my house. Trying to get a fire started so you feel very comfortable. This whole process leading up to surgery should be a very comfortable, warm, homey, family-oriented, we love you, our patients, kind of journey for you. So my intent for you is to create some videos so that you can use as backup to enhance your overall education. So if you go to Dr. Balsama's AdvoCare website, there are links there where you will be able to access these YouTube videos and also access, let me show you, the PowerPoint presentation, which you can print out or you can actually view online. I put it online as a PDF document, which you should be very able to read or to print out. After each of these presentations, you will also have a post-test that I'd like you to fill out. If you are a Bariatric patient, you need to return your post-op test to me. You can print it out, bring it back in, print it out, scan it, email it to me, but somehow I will need the copy of your post-test once you have viewed the video. Okay, with that said, I am going to look at the PowerPoint as I go through it so that I don't miss any valuable information. So there will be a series of videos that I'm going to post. They will all surround your nutrition and even more preparation to surgery. The first PowerPoint is called Diet Management Prior to Surgery, Class 1. So why are we even concerned about your diet prior to surgery? Number one, we want you to be as healthy as you can be before you have surgery. We also want you to make some valuable dietary changes that will make it easy following the post-op diet. We need to optimize your health prior to surgery, and the best way to do that is to make sure that your nutrition is balanced, that you have no vitamin deficiencies, and that you are as healthy as you can be before you have your surgery. That makes surgery much safer for you and your journey much happier. So what is our stand on weight loss before surgery? Some practices may require 10% weight loss. Our practice does not. We understand that your entire life you have tried diets where you have failed, regained weight, another diet, regained weight. So we're not going to put you through it one more time. We will, however, want you to make some changes in your diet without putting you on a diet so your nutrition improves. But what will happen as a result of that is that you'll probably lose a couple of pounds before surgery. The one thing we absolutely need you to know is that the insurance companies will deny you if you gain any weight prior to your surgery. So our goal is to not let you gain weight, and if you lose a few pounds in the process, all the better. We will be putting you on a pre-op fast 2 weeks before surgery. That'll be another presentation, and that fast will help shrink your liver. That's the purpose of the fast. Most people who have significant abdominal weight probably have fatty livers. And a fatty liver means your liver is enlarged, and during surgery it just gets in the way. So you don't want Dr. Balsama flapping your liver back and forth to get it out of the way. We want the liver out of the way by shrinking it with some weight loss prior to surgery. So it is advised that you not gain weight during your pre-surgery workup. Any weight gain from your initial weight when you come in for your initial appointment with Dr. Balsama will result in an immediate denial from your insurance company. So this is really important. We at our practice focus on changes, not on diets to manage your weight. Diets do not work. As a matter of fact, diets are the main cause of obesity because people lose weight, they gain it back, but what you gain back is fat, and the more fat storage you have, the lower your metabolism. So when you lose weight again, it's much easier to gain back. That's why diets are such a vicious cycle. Healthy changes are where you want to go with this. In general, if you're a calorie counter, I usually don't even give calories to our patients. I just streamline with my patient what changes they think they're able to make, and that is our approach. But if you're a calorie counter, for most men, 1,800 calories is adequate prior to surgery, and for women, 1,600 calories is adequate. Change what you eat gradually so it's not such an abruptness in your routine, and then you can't stick with it. Focus on what you eat rather than how much you eat. You can fill up with a lot of low-calorie foods and be very hungry with a lot of high-calorie foods. Some foods provide greater fullness or satiety for the same amount of calories. The more satiated or full you are after a meal or snack, the less hungry you will feel. And if you also increase your fiber intake, you're going to feel full faster and longer. So the two food groups that make you feel faster and keep you full longer are protein foods and fiber foods. Most of your protein foods are going to come from meats, poultry, fish, light cheeses, beans, soy, things like that. And fiber foods will come from vegetables, some fruits, and some whole grain starches as well. So make sure now you include some fruits in your diet, veggies in your diet, whole grains in your diet. Most people should have between 2 and 3 servings of fruit a day. Now, a serving of fruit isn't a big serving. An apple the size of a tennis ball is a serving of an apple. Generally, a typical banana, half of a banana is a serving of a fruit. About 12 grapes or so would be a serving of a fruit. You get more bang for your buck if you eat berries. So blackberries, blueberries, raspberries, strawberries are the better way to go. 1 cup of berries is considered a serving. Do not eat dried fruit. They are dehydrated, and you don't want to be dehydrated either. You get some nice hydration from eating whole fresh fruit. So tips to manage your nutrition prior to surgery: don't eat when you're not hungry, but don't not eat. Many of my patients coming in for the first time are meal skippers. You do not want to skip a meal. You must have a breakfast, lunch, and dinner every day. If you were going to skip anything, it's better to skip the snacks in between and skip the snacks after dinner. One of the major causes for weight regain after surgery isn't what you're eating at those 3 meals, it's what you're eating in between those 3 meals. So that's the time to ditch eating. Lots of times people eat not only because they're hungry either. And that, excuse me, that's a whole nother PowerPoint to talk about mindless eating, emotional eating, nighttime eating. There are other reasons that drive the need to eat other than hunger. Sadness, depression, frustration, anger are some of those. I may make a PowerPoint on that so that you learn from that. That's really important. So do not skip meals. Avoid foods high in fat and sugar, such as fried foods, cheese, whole cheese, 2% milk, whole milk, butter, margarine, refined oils, fatty meats, hamburgers, pork, sausage, fast foods, pizza, candies, pastries, cookies, ice cream. Now you're going to say, I'm not having surgery now because these are all things that give me pleasure. So your new mindset is there are other things in life that will give you pleasure. You're not to get pleasure from food. You get pleasure from being with people you enjoy. You get pleasure from physical activity. From now on, food is to nourish your body. It is fuel for the body as gas is fuel for the car. You will be able to indulge occasionally in some of these foods that we want you to reduce, so you're not going to have a lifetime of suffering after surgery. You can modify your existing recipes. You can cut the fat and sugar in recipes by using maybe egg beaters or egg whites in place of whole eggs. Reduce the amount of fat to cook. You can use some unsweetened applesauce in exchange for fat. Use non-fat versions, skim milk instead of whole milk. The only milk you really should be drinking is either skim milk or fat-free milk, or no more than 1% milk. Use lean poultry as your protein choices. So what's a lean poultry? What's a lean meat? Poultry is a lean meat, whether it's chicken or turkey. It's really hot sitting in front of this fireplace, by the way. You don't want to eat the skin of the poultry, nor do you want to fry it. Add more vegetables to existing meals to create bulk and volume so you fill up. So add vegetables to pasta, soup, stir-fried dishes to increase volume and fiber. Use Splenda or Equal instead of sugar, or if you're concerned about artificial sweeteners, your choice probably should be some stevia or Truvia. Extremely important is physical activity or exercise. Now, sometimes people think exercise is the way to lose weight. It is not the way to lose weight. Sometimes people stop losing weight when they introduce exercise because they're not managing the nutrition. Nutrition is the way to lose weight. Exercise is the way to keep the weight off. Exercise will be your salvation after surgery in order to maintain the weight you have lost through nutrition management. Physical activity helps support your dietary changes. It improves a lot of things in your life. It improves your skin tone, it improves your heart, improves your lungs, improves your digestive tract, improves the quality of sleep, improves your mood. So whatever level of physical activity you're incurring now, take it up a step, then take it up a step, because this is a needed component of your plan for life. If you're not an exerciser right now, you may want to talk to your family doctor before you start pursuing exercise, because we want to make sure that you are safe to begin any exercise program. Now, everybody will need vitamins after surgery, whether you have a gastric bypass or a sleeve. The vitamins we recommend are similar for either of the surgeries. Vitamins are to be taken for life. If you're pre-op, which you should be looking at this video, we do want you to start a vitamin. Men and postmenopausal women can start a vitamin without iron, but keep in mind, after surgery, everybody needs to take a multivitamin with iron. That's for, so without the iron is pre-surgery only. After surgery, all patients are going to need a multivitamin with iron, a vitamin B12, and a calcium supplement. And when I do the video on your post-op diet, I will go into more detail. Now, you will be getting blood work done. Make sure that you get your blood work done as soon as possible. It is not pre-admission testing. It's your pre-physical prior to surgery. It will give us an opportunity to see where you are with everything, correct what we can, so that you're at your prime health prior to surgery, which makes it 100% safer for you. So a recommended plan pre-op with your diet is maybe decrease some of your white starches, like potatoes, bread, white rice, pasta. Add vegetables instead. If you want to consume a limited amount of starch, make sure it's a starch providing some fiber for you. So black, red, brown, wild rice would be better for you. Sweet potato instead of white potato, whole grain bread with at least 3 grams or more of fiber in it is the way to go. Have a higher amount of your lean protein. Your diet after surgery is a protein produce diet. So make your diet now a protein produce diet, because you need to be eating enough protein and you need to be eating enough vegetables. No liquid calories. Liquid calories do not keep you full. They just add calories to your daily intake, and you're sure to gain weight if you are drinking your calories rather than eating your calories. Keep in mind that you can eat all the vegetables you want, except corn, peas, and lima beans are considered starchy vegetables. So you're going to limit them like you will limit your potatoes, rice, or pasta. Limit to 2 to 3 servings of fruit a day, and we talked about that already. Best if you include 2 dairy in your diet every day. So for our purposes, a dairy will be milk or yogurt, preferably Greek yogurt. So sources of lean protein, any fish, you just don't want to fry anything. You can boil, bake, barbecue, even saute is okay. So any fish, shellfish, skinless chicken or turkey, any part of it, lean pork tenderloin, center cut pork chops, Canadian bacon, turkey, lean beef meatballs. When I say lean beef meatballs, lean ground beef would be 93, preferably 96% fat-free. Not that I'm going to encourage eating beef. I do encourage variety so that you're able to stick with this. If your plan is not practical, you're not going to stick with this. This is why diets don't work, because diets are not practical for the long term. So having beef maybe once a week is really okay, providing you choose the right cuts of beef. So eye roast, round roast, sirloin as your steak choice, and then the 96% fat-free beef. Some deli meat is okay. I realize that it's processed. I'm a realist, so I know in this world, in our high-paced, no time to do anything, sometimes deli meats would be a good choice, providing you're not concerned about processed foods, which you should be, or you're not concerned about your sodium intake isn't a real concern. So, low sodium ham, turkey breast, chicken breast, and roast beef. Game meat is really lean. Not many people, though, eat deer meat or bison. I don't particularly like deer meat, even though I've gone hunting with my hubby. It just has a taste that I'm not used to. But bison actually tastes like steak. So if you've not tried bison, give it a shot. Lean meatloaf made with either ground turkey mixed in with lean ground beef or chicken is a good way to make meatloaf. And you can make your meatloaf moist by the things that you add in it to moisturize it, so it doesn't have to be dry. After surgery, by the way, the worst thing you want to do is eat dry protein, because it's gonna feel like it's stuck right there. All of your proteins after surgery have to be super moist. You never wanna well done cook anything. So veggie, bean, soy, turkey burgers, lean burgers, boga burgers, turkey sausage, turkey bacon, occasionally you can have them. So tips, protein is a bulky substance. It will make you fill up faster and keep you full longer. That is the secret to managing your calories. Practice eating your lean protein first, because after surgery, that's what we will have you do. You must eat your protein first, veggies second, and whatever little starch you have on that plate, and starch will be the smallest amount of food on your plate, you can have. If you don't get to your starch, we're happy about that. Make sure you chew your foods really well, because if you don't, you're gonna wind up throwing up. Your stomach is small now, and it's going to have a hard time processing a chunk of food that you did not chew well first. So try and give it a dry run, chewing every bite of food 20 to 25 times just to see what that feels like. You need to start the process of digestion in your mouth by breaking it down before you swallow it. Eat slowly. We all tend to eat too fast. If you eat too fast after surgery, I guarantee you will be throwing up. How can you slow yourself down? Well, if you chew your foods real well initially, that will slow you down. Eating with chopsticks, if you're not used to eating with chopsticks, using toddler spoons or forks, you'll take smaller bites. Putting your fork down in between every single bite will help as well. No mindless eating at meals. That means you should not and cannot have your meals in front of the TV set. That creates mindless eating. You will always wind up eating more than what you should if you do that. And that includes not being on your iPhones or on your computers or laptops during meal times either. Your meal times should be at your kitchen or dining room table. You must eliminate all carbonated beverages, because after surgery, there's just not any room in your stomach for carbonated beverages. So even if you're a diet soda drinker, you want to get rid of the carbonation. Crystal Light, water flavored with maybe a little cut up fruit. And there's a ton of flavored lower than 15 calorie option beverages out there for you. Now, hydration is our primary concern after surgery. So one thing you need to do is get into the habit of hydrating well. The number one reason people wind up readmitted back to the hospital after surgery is dehydration. So drink at least 64 ounces or more of some fluid a day. Water hydrates your cells, your hair, your skin. It is what makes your body function. So if you're not hydrated, you're not going to be a well person. Water also has no calories. It helps eliminate wastes. It helps prevent constipation. It helps get rid of wrinkles for women because your skin cells are plump with hydrating water. Your color of your urine is your indicator for hydration. Your urine should be clear to very light yellow, and that will mean you're probably doing a good job with your hydration. Again, make sure you drink 64 or more ounces of water every day. After surgery, we're going to want you to do the exact same thing. Okay, this is our last slide. It's on measurements. You really need to know what 2 ounces looks like, 4 ounces, 6 ounces, 8 ounces looks like, and even what 1 ounce looks like, because after surgery, that's how we're going to prescribe your diet. So there are things around the house that will help you do that, such as if you get this little cap is like on the top of medicine bottles. This is about 1 ounce. 1 ounce is 1/8 of a cup. 2 ounces are 1/4 of a cup. So you fill this up 2 times, you'll have 1/4 of a cup. This is a sugar-free rice pudding container. It's about 4 ounces. That's 1/2 a cup. So half of this container would be 2 ounces, 1/4 of a cup. So if you have something like this around the house, put it aside and keep it so you know how to measure your intake after surgery. If you have a measuring cup like this, of course this is going to help you too, because this is labeled in ounces and fractions of a cup. So a measuring cup will help. This actually is from the Bariatric company. I think you can even get this online. It's a cup with cup measurements on this. This is a measuring spoon. Not that you have to use a measuring spoon, but I do want to emphasize that this part of the measuring spoon, that is a tablespoon. When you start to eat food again after surgery, that might be your meal, a tablespoon, if that's all you fit. And I don't want you to be startled by that. Eventually you're going to eat more than what you wish you could. So take advantage of the earlier stages in your plan after surgery to lose the maximum amount of weight that you can. Your window of opportunity for weight loss after surgery is the first 6 months. So you want to be impeccable in your behavior because you'll never get that window of opportunity back again. Okay, so we are done your first PowerPoint presentation on your preoperative nutrition. I hope you've enjoyed it, and I hope you come back to my house again when I start the PowerPoint presentation on stage 2. I want you to know too that you have chosen an excellent surgeon. I've worked with Dr. Balsama now for a number of years. I can't fathom working with anybody else. You are in good hands. Our community at our office is very family oriented. Thus, I welcome you into my home. So farewell, good luck, much love, and I'll see you for your second presentation.